Hi there, my name is Vicki Evans. I'm with Seniors Blue Book, and today I'd like to introduce you to Jenna Girton, owner of Dignity Hospice. Jenna, please tell me about Dignity's expansion to Northern Colorado and what makes you different.
Well, gosh, thanks so much for having me today, Vicki. I really appreciate it. Yeah, those are great question. So Dignity has been in Colorado since 2010 and have just really enjoyed servicing the Denver metro area for the last several years. A little bit about us, we are locally owned. It's my husband and I, so we're female and veteran owned, and just honored to provide care from Parker to Longmont. We've expanded into Boulder County, and we're super excited. We are opening an office in Fort Collins. So this is sort of our Larimer County expansion. So we'll be providing care in Loveland, Fort Collins, and Greeley. We'll have an office in Fort Collins that's currently being built out. We're scheduled to get in here in the next several weeks with a grand opening that's going to take place on the third Thursday of September, which is the 16th. So we're really excited to hopefully get the community out and kind of educate people on who Dignity is and what we have to offer up in that area. As far as, what sets us apart, we call it the Dignity difference. And I think that really is something that makes us unique. We are just really honored and proud to provide care to people at the end of their life and to their family. And so what that looks like for us is we've tried to look at what Medicare requires and then kind of take that to the next level. And so with that, I'll kind of go through our levels of care. Our RN case managers, which are the nurses out in the field providing the care, they provide visits 1 to 2 times a week at minimum for each patient. And that's really just to make sure that we are on top of all of their medical needs. Second to that, we have our CNAs, which is our certified nursing assistants, and they provide visits 7 days a week for every patient. And that's a really big differentiator for us. We're proud of that. I think it really ups our level of care in the sense that we have eyes on the patient every day. So if one of our aides notices a change in condition, it really is a fluid conversation with our nurse. We can kind of get somebody out there to assess and see if we need to change a medication or so forth. With that, we have social work and chaplains that go out to see their patients once a week. Again, that's not an industry norm. In our industry, we typically see those visits once per month. But for us, these people are at the end of their life, and we want to just make sure we are there for them as much as humanly possible. So having that once a week visit really does build rapport and trust between our team and the patient and their family. And then along with that, we do have a volunteer program where we offer pet therapy, even some music therapy, and we also have art therapy if that's something that someone would be interested in. And then last but not least, we have massage therapy, and that's something really unique to us. It's not a Medicare required service, but for us, we feel like people need people, and more than that, we need touch. And so what we've seen, a lot of patients at communities, there's a lot of people around them and a lot of just activity going on, but not necessarily connection or human touch. And so our massage therapist, we assign a massage therapist to each patient, and they go out, they visit the patient once a week, provide light touch massage, and really just try to love the patient exactly where they're at. So for us, yeah, I think those are our Dignity differences, and we're just trying to go out each day and just love these patients the best we can and give them the best quality of life with whatever time they have left. So it's a little bit about us.
Wonderful. Thank you so much, Jenna. I
Yeah.
really look forward to seeing you out in the community going forward.